You have been there for, I thought I spent a long time at one company.
Yeah,
You beat me by a lot, yeah, which
Yeah.
is really impressive and exciting.
Yeah, I mean, it is the type of place where there's so much going on that, you know, I feel like I've had a variety of careers within one organization.
Yes, exactly.
The beauty of it. Yeah.
And I like that combination of operations and finance. Actually, that's what my husband does for in the financial industry. He's COO with the finance part, but not the investment part. So yeah, it makes a lot of sense.
It's a great combination. Yep.
Doug, did you want to kind of give a little bit more intro, or do you want me to just kind of launch into?
Well, let me just start it off by saying, obviously, this is kind of an outgrowth of the panel that I did with you, Sally, and Dean, and I think I'm trying to remember who the third person was. Back in March, right? And so this is really, kind of an outgrowth of, hey, what really did happen in 2020, right? What painful lessons did we learn, but what changes were we able to engineer in the process? And then what benefit do we think that's going to pay going forward into 2021 and beyond, right? And I think particularly, I know one of the things that you talked about in that March session was the fact that you guys were kind of wholesale into innovation, right? That you were looking at new ways of doing things, you were looking at new products, you were getting, if anything, you were almost getting deluged with offers of help from corporate America and other people. So how did that work out? How were you able to manage that, and how, what positives did that turn into?
We're actually calling this finding the silver lining, or finding the positives out of the pandemic, because otherwise we would sit here and be down about what everyone's been living through. That's a great way to start. Why don't we go back to the what really happened, just from your perspective, just for a little bit of background. Jeff Weedman did talk a lot about innovation, about product innovation, talked a little bit more about the CPG industry and how they've kind of taken this. When we got to Dean, he obviously looked at it from an economics perspective and covered some key metrics, how he thought that the pandemic would be viewed. He really thought that we're going to end up being kind of a blip. But he got a little bit into the impact on healthcare. So I actually have a few questions that came out of that session that I'd love to talk to you about, the impact of retail, the impact of some of the biotech stuff, because some of the spending on traditional low profit monitoring things went down. Will that spring back? So a lot of kind of specific to healthcare. We're going to try to cram a lot in a half hour.
Okay. So anything you guys could give me to help me organize my thoughts, because I definitely have to go back and kind of say what would be a logical sequence. So, often when I talk about what we went through is, yes, early on, I would say our biggest challenge was being overwhelmed with offers to help, in particular for PPE. That everyone knew healthcare was challenged. I think, some of our lessons learned now is, our supply chain was perhaps fragile in many ways. People were trying to be as lean and leverage contracting to set kind of single vendors, just on time kind of inventory delivery. And when some of the crisis hit with PPE, that, made us feel, I'll say, particularly vulnerable.
Right.
Our staff noticed right away we went to a high degree of centralization. So it was a tough time, because I think the staff were feeling panicked that we didn't have any. And in fact, we were just managing it more tightly and very differently. People were used to just opening a cabinet and being stocked. Right. So if they saw it empty, they assumed we didn't have it, not perhaps that we had to control and manage it very differently in time when people were pretty panicked. We had to set up right away an inbox to manage all the offers to help. I said I had 22 FTEs work for me to just sort through various offers of either donated goods. And the two categories were primarily food and PPE were the two. It was so generous of the help and how many retooled their industries. I do examples of companies who started making, whether it was hand sanitizer or face shields for the first time, they weren't in it, coordinated with us on things like, can you get me the specs, and I can build some, stood up some research groups to test the products to make sure they were safe, etc. So a lot in that space I could speak to. I would say also you spoke to, this group in technology. I would say the other big things we did stand up a lot of are one, obviously virtual visits as an industry healthcare has adopted. I don't think we'll go backwards on that. We have leveled off now that about 35% of all visits are done virtually. It was less than 1% historically. And I think that number is shown pretty stable. But even now, I'll use the example, even though we've stabilized at roughly 35%, our one snowstorm this year, we basically did a full schedule. We were exactly equivalent because others converted kind of within the 3 days, because we had some advance notice, right? With the 3 days notice, right. we never saw a blip in our volume.
Hey, Sally, let me ask this. What was the resistance to telemedicine and virtual visits prior to COVID? Because obviously the necessity, right, is what really kind of bred the change. But what was ultimately the obstruction, or why didn't? That technology has been around for 15 years.
Yeah. I would say it was a couple things. I would say, the regulatory hurdles and payment incentives were, I think, just a fundamental backdrop that obviously COVID changed. And it is interesting, right, that changing those two things then led us to do it at a broad scale and standardize it. So you had enough people doing it consistently that you really tried to fine tune both your workflow, your operational workflow, and technology to really maximize it. Hard to do. When you do a couple a day, I don't think you quite get the experience of how to set it up. So it was probably the combination of those two things, the incentives and the regulatory changes, and that we didn't have a choice. And then because we are now in it at scale, you put some significant resources towards creating a kind of, I'll call it a standard operating procedure that would work effectively, and all the supports, right? People, the biggest challenge we have is often the first visit with a patient, because they have startup energy as well to adopt it, not only the providers, but the patient. Right. So you had to really set up that infrastructure to, and then you find once patients have used it, they like it, we like it. It sticks.
Yeah, there's a lot to be said for people keeping habits that they've had for a while. If everything was done in person, then everything will be, until something comes along to change it.
Correct.
And I'm wondering, because of the environment change that we've got here, are there any other consequential changes that have been enabled by the need to change something like the telemedicine link and some other things? Has that made some other changes easier to do because of the environment being more available to change?
I think it has to be, and I guess I'm going to try and think through those to find other examples. I mean, obviously, I'd say meetings and travel too. I mean, I look at what I've done and how, I was on a board that required travel, and a lot of people used to call in. Now being Zoom, boy, I find those meetings more effective, right? So I'm sure there's going to be a whole bunch in the same in the administrative as there is in the clinical around what is worth traveling for it in person and what can be done differently. I want to definitely think through some of the other areas where I feel like we have evolved and some of those lessons. As I said, I wasn't quite sure which direction this panel was going to go through, but I will definitely think through that.
Especially where Doug kind of led off with the innovation. So, if you had said, 5-10 years ago that we were going to be talking about telemedicine and we were going to be talking about, consumers using devices to manage their own health and, kind of those innovations and how that's interacted. But I'm curious, the innovations that Doug was kind of alluding to, what else, what are they procedural things like the telemedicine? What else, what other big innovations have come out of this?
I know, that's what I'm trying to think of, other big ones that have come out of this. Telemedicine is some of the biggest. Again, I would say it has pushed us quicker to self-scheduling. would probably be one I'd put for a variety of things. So we have stood up an app for rolling out of the vaccination, for example, although again, we did manage to crash it the first day, which got some media coverage, unfortunately. But we stood up software for rolling out the vaccination. The first thing it did is screened every employee, which wave were you eligible in. So, somebody like me, I'm not a frontline provider, so I'm wave D, not A. It screened you and gave you what wave you were eligible to receive the vaccination in, and then allowed you to self-schedule your appointment if you were eligible. So we've been doing a lot with that. We attest on an app every day to our health status. That was, a big part of the whole screening. So there's been, I'd say, a lot of activity in those type of apps.
There's just a lot more data around, right? I mean, if you have those type of apps, I interacted. I had a COVID test. I actually had a few weeks ago, and for the first time, I had an interaction with a lab to get my test results.
Yep.
And again, you've got Peloton and Amazon, collecting all sorts of other health data. There's a lot more data about our health and about our spending habits now. Has any of that impacted you guys from even an IT perspective, saying, hey, this is how we can look at our demand or our supply differently?
I guess I would say we definitely have people, particularly in our research, who are interested in combining data sets, both data that we have here within our own medical record. I would say a lot of work is being done to saying the devices we use here have data in them, and can we get it into a repository?
Right.
Again, all the monitoring system, ventilators, et cetera, right? All that data exists. It hasn't always been captured in a repository or combined with the medical record in a way that would advance both research and innovation. And that more of that is coming. I'd say we were working on some of that pre-COVID, but probably COVID accelerated some of that. And then how you might combine it with other outside data from wearables and other things like that.
Right.
Home health is one. Yep. Again, it's still a form of telemedicine, but a lot more of that. Trying to think, a lot of apps around how to keep patients and our families, because of visitor policy changes, aware of what's going on.
There's just a lot more data, and I think people are aware of the data, and some are embracing what can be done and how it can improve their lives and their medical treatment. And I think some are still, the privacy concerns are outweighing everything else. Little do they realize they have a credit card on their phone, they can be tracked anyways. But I think there's a lot more data available than there ever was before.
Agree with that.
Yeah. Can we go back to kind of do you have any numbers that you can share with us to kind of start off just the magnitude of how 2019 differed from 2020 and moving forward? Some of just kind of a baseline.
So you mean like, I just want to make sure I have it right, like how COVID has impacted our business?
Yeah. And again, I don't want you to share proprietary information.
No, I'm trying to, I mean, again, I guess, well, let me rattle off a few things and tell me if I'm hitting the mark. I would say we had the big wave of COVID in April here. We peaked at over 420 inpatients at that time. This second surge is right now about half of that, barely half of that. The big difference is, I think, the first surge, we, shut down all elective activity. And now we saw some of the consequences of that, right? So we are now trying to keep fully running the rest of the hospital and absorb this surge at the same time. So that's why it feels still pretty challenging for us to juggle both. I think as an industry, nobody wants to shut down elective if we don't have to, because let's face it, it's still not discretionary activity. And we got pretty worried by what we saw the first time along. I don't fundamentally believe that strokes decreased 30% back in, the surge. I think people avoided or put off seeking treatment for some of those symptoms. and those things would have long-term health consequences. So that's why I think there's a commitment now to not shutting down the rest of the industry and try to juggle this surge while we remain open for all other business, and that is a challenge.
So what do you think that means long term? Let's kind of fast forward and you know, we've got whatever you call herd immunity, or everybody's got the, you know, had the vaccine that needs it. So what changes to your business happen? Are you hearing there's a lot of noise? I don't know if it's just on my end. Can you hear okay?
A little bit, yep. I should hear some stuff. Typing.
Doug, I think it's your mic that's making that noise. So if you'll mute it when it's, I think I've got you muted now.
Okay. Yeah. Okay.
Oh well.
It's okay. Can you just think forward to, you know, 2021, 2022, 2023? Do things get back up to normal? As Dean said, do we look at this kind of as a blip that we've learned from? And I want to come back to kind of what we may have learned, but do we get back to normal levels?
I think we do. Now, again, I do think we'll get back to normal levels. Again, when I think of some of those, I'll call it macro lessons learned from us, though, I do worry more about retaining some capacity for future surges, whatever the next event might be, right? So at my organization, we have run at such a high census that we have not had, we didn't have any excess capacity to withstand something like that. So I worry about things like that. I made the comments earlier about the supply chain, same thing. Just-in-time inventory, I think we have to revisit some of those. How lean? Healthcare is just known, high fixed cost industry, full, dense packed, were all considered great financial indicators. Should they be going forward, right? Do we need a little bit more for kind of the public good of standby capacity for those things that we cannot anticipate? So I think you're going to see some of that shift in the industry. Now, again, not everybody is the same, but
just at a macro level, those supply chain indicators. I'm just not familiar with how this works within a hospital setting or a healthcare environment. But is there a supply chain group that has been focused on, making you lean and mean over the years, over the decades, that now that those supply chain executors, I'll call them, are going to have to step back and take a look at, okay, how can we do this differently moving forward? Or
I think so, because I think the belief was, you needed to take a healthcare system like ours, right? So not just one hospital, the entire health system, and converge on a single vendor so that you could drive down the unit price. And driving down the unit price was the goal by converging on a single vendor. Well, when that vendor, has challenges, whether it was, again, in particular, we saw it, even some things like hand sanitizer or gowns, right? When the single gown we use for infection control, they can't produce it at the same rate they used to during the surge, that becomes problematic.
Right.
It is not easy to, we're a highly regulated industry, right? And so it's not like another vendor can just hop in and start to produce that product.
Right.
Under the infection control and regulatory environment that we have. The same for like N95, the respirators that we use. We have to test fit them to each staff. So if we have to switch vendors, then we have to go test that fit works on every employee. So whole scale change like that for our industry is not easy.
Okay.
You expect some changes in that because of this crisis that we've been through?
I do. I wonder if being dependent on a single vendor is the way to go, or if you will now see us, share the book of business with 2 or 3 vendors more than we have done in the past, as an example. Yep.
I think a lot of the economic pressures and the societal pressures are higher on the healthcare industry than they are on maybe any other industry because of the past year. And it's obvious that some changes have been inevitable already, but I have a feeling that since we've got the ball rolling in that direction, I expect it to change some more.
Yep.
Again. Doug,
Yeah,
can you hear me? You had to mute.
yeah, Doug, if you just mute your mic when you're not talking, I think we're going to be okay.
Okay.
But I'm not sure if your mic is rubbing on your clothing or what. But
Okay. I think that those are some of the. I'm just very conscious of your time, so I don't know. Do you have a hard stop at 11?
I have someone coming up to my office. They're not here yet. Yeah.
Okay, so given that I've got about 3 minutes left, and I've got those are some of the big picture questions that I think
Okay.
we want you to really address.
Yep, I will ponder and make sure. Yeah, I've got some data and stuff to back some of those up. Yep.
Okay, I've got a few other things that I just kind of wanted to run by you, and these may be things that that we can do as an aside, because I just would love to get your perspective, and I think that these kind of questions we'll bring it down to the CPG level. So I don't know if we do them over email, or if it's something that I can just interview you again for another 5-10 minutes later, and it's something that I write up and we post. But I'd love to hear your perspective on the impact of retail. So CVS, Walgreens, the Minute Clinics, on two things: on consumer health. So is the consumer maybe using those clinics, those kind of, is that helping or hurting? And then on healthcare as an industry, what is the impact that you guys are seeing on your business?
Yeah.
And then biotech. Yeah. Everything from the impact of the products themselves to, for example, the vaccine, the speed of the vaccine being brought to market in 9 to 10 months instead of, multiple years. How does that, how does the changes in biotech, how has this impacted? You used the word accelerate, and we talked a lot about that word with Jeff Weedman, because I think it's accelerated, the pandemic has accelerated the technology adoption and the willingness of people to do things a little bit differently. There were a lot of businesses, especially in retail, that were headed down a certain path, a lot of consumers that were headed down a certain path that is just, the number of online shopping has just skyrocketed, and we think that will continue.
Okay.
And then the last is some of we've alluded to this a little bit, the technology role. So the apps that are all over the place, the contact tracing, the consumer interactions, things like, your Fitbit and the Apple Watch, Peloton, and that mirror thing that Lululemon has, how has that impacted both the ability for consumers to self-monitor their health at some rate, but will that ever be combined with some of the actual data that you guys have stored, some of the historical information? So curious about kind of your input on that stuff.
Okay.
Doug, I know we asked you to mute, but is there anything else, any big picture things that that you want to get on Sally's radar?
No, well, actually, I think one of the more interesting ideas that you already mentioned, Sally, that we could probably spend a little more time on is, has the definition of emergent versus elective changed? Because to your point, right, lots of the symptoms haven't stopped, right? And they never stopped during the pandemic, but clearly healthcare seeking behavior did. And so, I know that a lot of, I don't know that anyone knows what the long-term impact of that's going to be. And certainly the other kind of side bet to that, or side idea to that, is we have no idea what COVID's really going to wreak in terms of long-term cardiac problems and stuff like that. But what have we learned about healthcare seeking behavior and healthcare resource utilization from a patient, almost consumer perspective that we didn't know before, and that there would have been no other way. There were lots of, and actually what'd be really cool is to get you and Dean to talk about that, because there's all kinds of econometric theories on that. But we actually, the economic theory got put to practical tests.
Yep. Yeah. And again, it showed there were, as you said, the resources and the behaviors did change. Again, you got to believe the fundamentals of, the symptoms didn't. I mean, some did, less trauma and driving, but
Well, I think that one of the kind of public fears, right, is that healthcare is going to consume the world at some point, right? think what we saw this year, probably, or back in 2020, more so than anything else, is that there is a fundamental difference between healthcare need and healthcare demand, right? And
Yep.
but what does that mean? And then what does
Yeah.
that mean in terms of running a a healthcare system? But what does that mean in terms of health policy, in terms of government funding? A whole bunch of other questions.
Yep. Okay.
I don't think we'll, and and that's probably the one other thing that I would throw out, because I know how well read you are, and that's one of the reasons that I like interacting with you. Where do you go, and where did you find your truth? In the middle of the pandemic, right? Obviously, you had all your internal systems and your internal monitoring, but were there specific authors? Were there specific writers? Were there specific websites that you built confidence in? In all of the data and information and misinformation that was exploding across our country. Where'd you go? Where'd you find?
I mean, that is actually an interesting theme to pull on a little bit, because in many ways, a lot of what got put out there, certainly by various states and federals, was just that data without interpretation, right?
Yeah.
And so you would go and study the data, and it was fascinating to me to see how different colleagues, how we might be interpreting the same charts, similarly or differently, right? Because we put out data and dashboards, and yet people had different interpretations of them. Yep.
Well, actually, what would be really interesting too, I think, from your perspective, and you'd be one of the few people who could comment on this, is how do you then begin to put data out into the public domain that doesn't get reinterpreted? That doesn't get, because healthcare for most people is a rather complicated topic, right? And so it's real easy to put a number out there that, depending on your political persuasion and your point of view, you can interpret or reinterpret. Hell, we had people claiming that Dr. Fauci was an anti-technologist. I mean, but how crazy. But in an unfactual world, how do you actually put out productive facts?
Yeah.
And what Doug usually asks is, and what social media do you then go to?
Right.
Yeah.
So are there? I'd be curious, just on a personal level, who do you follow on Twitter, or which blogs do you read? So that's something that I think would be interesting.
Which is interesting, because I don't go to social media. Well, it's really enough, right? What does that say about my age is for some of it? But okay.
Well, Sally, actually, you're going to laugh, but the whole point behind this effort that we're doing is literally, it kind of was an idea that grew out of that meeting that we had at U of M, the alumni gathering, when I basically kind of confronted the dean and said, hey, look, you aren't using us for anything. You have incredibly talented people sitting around this table who can really help you understand what's going on in the world, but no one's calling us. Well, I'm calling. Good. Our whole goal is to build really kind of a web-based portal of access to really smart
connecting.
people. Yep. Like you and like Dean and like Jeff, and then have all of you not only interact in ways that you otherwise never would, because you wouldn't have the time or you wouldn't be able to expend the effort to find each other. But then
you wouldn't have the desire. I mean, you wouldn't necessarily. You talked about supply versus demand. You wouldn't necessarily have the opportunity or the impetus to talk to a P&G executive, other than how do you make hand sanitizer for us.
Right. Exactly. No, you do. You tend to, go to other people in more like industries versus crossing industries, and knowing how many lessons learned are common. Yep. Okay.
And so our goal is to literally become that kind of first place that people go to and follow, not so much for what we have to say, but what we get other people to be able to say.
Those connections. Yep. Okay, good. All right. Well, I'm going to have to run.
Last thing. We're looking at Monday, the 18th, to do a dry run of this technology, as well as to get you and Jeff and Dean all on the phone at the same time.
Okay.
So we're looking at 1 p.m. Does that work for you?
All right. It's a holiday here in Boston. We celebrate Martin Luther King Day. So I am off, and I don't know where I will be.
Okay.
But if you send me an invite, I can try.
Okay.
Yeah. Yep.
Well, the fact that we've gotten you on, the plan is to use StreamYard. So, so you've already used the platform. So actually, other than, getting a chance to talk to Dean, I don't know the last time you talked to him, and then meet Jeff, it's going to be literally 10 minutes, 15 minutes max.
Okay, good.
And, and we're going to get Doug a better microphone.
Good. All right. Great.
Thank you. Thank you very much. It was nice to meet you. I look forward to working
Thanks,
with you.
Sally.
Thanks.
Bye-bye.
Bye-bye.
Okay, that was weird.
Let's see. Okay. All right, I guess we're all going now.
Did I drop off?
Yeah, I'm going to end the broadcast.